Hello, my name is Marcy, and today I will be talking to you about family planning. We have 5 tips here available. I'll be talking to you on the 5 tips of family planning. The first step is the daily tablet. We want to know how to take the daily tablet. For the daily tablet, you take it every day at the same time. And if you miss the tablet, you forgot to take your tablet, and you get reminded the next day, you have to make sure you double it so it works, because the tablet works only for 24 hours. So if you miss it and you don't double it, you'll be like causing yourself harm. It's possible you might get pregnant when you have sex. And how it works, it stops ovulation. It stops the sperm from meeting the air. If you are on a daily tablet, and the sperm will meet the air so you can born, so fertilization can take place. And the benefit is for some women, it stops them from receiving. If you're taking it, you will not receive for some women, but not for every woman. And for some women, they receive, but the blood can really be less. It can be plenty. It just comes small. And for some women, it stops menstrual pain. During menstruation, some women have pain within the stomach. But if you're taking the daily tablet, for some women, it stops the pain. They don't have much pain when they are receiving. And for some women, they can receive normally when they are on a daily tablet. But another one is, if you take it correctly, it stops you from getting pregnant. So it's advisable that you take it correctly. The way the doctor tells you to do it, you take it correctly. And the next one is, we'll be going to our next one. The IUD is also called an intrauterine device. For the IUD, how to take it? You go to the hospital and the doctor insert it into your womb. They put it into your womb, and it is there. A professional doctor, someone who knows about it. When the doctor is putting it, you will feel a pain, but it won't be too much, just a less pain. But when I realize for like 2 minutes, and it will stop. And the IUD lasts for 10 years. When you get the IUD into you, it lasts there for 10 years. But whenever you are ready to have a child within a 10-year period, and maybe 5 years after you say, oh, but I want to have my child, you can go to the hospital, and then the doctor will get it out, and you will have your child that you want to have. And for some women, it stops their periods. They don't receive, but it is normal. For some women, it makes that period to be very light. The blood comes small. And how the IUD works, it stops the sperm from reaching the air. When you are taking the IUD, the sperm will not reach the air, so fertilization can take place. So definitely, if you are taking it, you won't get pregnant. So the next one, our third one, we'll be talking about here today. That is an implant. For the implant, how to take it? You go to the hospital, and the doctor put the implant on your arm, right here. They open your small, and then they put it there and close it. But in that process, the doctor can numb you. You will not feel too much pain. The type of pain you will be worrying that, oh, if I go take the implant, the pain will be too much. No, it will not be that, because the doctor will numb you that you won't feel pain. And for the implant, it lasts for 4 years. If you take an implant, it's already in you, it is there for 4 years. But within that 4 years now, maybe after 2 years, you say, oh, I want to have my child, you can go in the doctor, you can get it out, you will have your child. And how the implant works, the implant releases hormones. It stops the air from being released. If you are on the implant, your air won't release, but it's normal if you are not releasing air. But anytime you stop, anytime you are not taking the planning again, you'll notice that your air will start to release, and you will have your child when you want to. The benefit is, and for some women, it reduces their period. They don't menstruate too much, the blood will not come plenty. It lasts for 4 years. And we'll go to the next one. The next one is the double shot. That is an injection. How to take it? You go to the hospital, and the doctor will give you a special injection that have the family planning within it. And the doctor will give it to you either on your butt, or on your hand, or on your arm. Just as people can get injections to the hospital, that's how the doctor will give you the double shot. And how it works, it releases hormones that stop the air from being released. For the benefits, it prevents you from getting pregnant. If you are on a double shot, you will not get pregnant as long as you take it. But remember, the double shot lasts for 3 months. And after the 3 months, you make sure you go back to the clinic so the doctor can give you another one. Because if you don't do that, you are at risk of getting pregnant. And we'll be talking about the next one here. The next family planning. That is a condom, especially the male condom. For the male condom, it's very important because the condom will help us to stop pregnancy and other STIs. But the family planning can only stop pregnancy. So we advise people who are on the family planning to also remember and go and use condom, because if you are using the condom, you also be preventing yourself from pregnancy and preventing yourself from other sicknesses. Many girls are dropping out of school these days because they are getting pregnant, and as you get pregnant, the principal or the school authority pull you out. At the end of the day, they won't reach their goal. If you are on the planning, you will reach your goal because you will not get unwanted pregnancy. And the family planning can also help us to decide when we want to have child, when we want to have our children. So if you're on the family planning, the time you're ready to have your children, you will have it. You will get baby by choice and not by chance. One myth that we always hear in the community is that if you are on family planning, you will not born in your whole life. But I will tell you that family planning can even fertilize the womb. If you take family planning, anytime you leave here, you will born. So people say if you only you will not born, that will not lie. It's not true. And another thing people can say is that if you are on family planning, being that you are not menstruating, meaning there's a growth that is growing within your stomach. But I will not lie. If you on family planning and you are not receiving, it's normal. Because for some our family planning is start the ovulation. You know, if you ovulate and then the egg gets to the uterus and there is no sperm there to fertilize it, it will come down at menstruation. But as long as your egg is not releasing, if you are not menstruating, there is no problem about that. That you are not comfortable with, we advise that you go to the hospital and get medical advice.